Hello, my name is Janine Limoncelli, and I am a physician living in Ridgefield, Connecticut, and was asked to talk to you about my experience during the COVID-19 pandemic. I am an anesthesiologist, and I practice at Weill-Cornell Medicine in New York City. And my role there is I'm the director of anesthesia in the operating rooms at the DHK Ambulatory Center. So when COVID first started to rear its ugly head in New York City, all the elective cases within New York City were discontinued. So because of that, everyone at my facility was redeployed within the Weill-Cornell system. And in the first couple of days, I think that I know there was this feeling of disbelief amongst all the staff members, whether or not you were a physician, a nurse, a PA, an administrative assistant. We just could not believe that this was happening not only within our country, but within our city. So our first feeling, Weill-Cornell has a simulation lab, and we were all redeployed to various places within the hospital and within the whole NYP system. So we all had to go to a simulation lab where we were learning how to put on PPE, the personal protection equipment. And I remember that day because it was so impactful, because the terror in my colleagues' eyes was unforgettable. I had never seen that look before from them. People actually said, "I am terrified," as we were putting on all this equipment and not knowing what we were going to face. What we did know, and I think the reason why we all felt so terrified as healthcare professionals, was that in the past, we treat people and we connect with people and we feel for them and for their disease processes. And sometimes it's like, oh my gosh, that could happen to me. But it's very far off there. It's not in our usual day-to-day. We're not going to catch this person's, appendicitis. It's unlikely we will get that person's cancer. So we're able to go ahead and treat the patient to the patient's best benefit. With COVID, that barrier of safety between catching what the patient has was completely gone. That going in to treat a patient meant us, particularly as anesthesiologists, putting our life at risk, and not only just putting our life at risk, but putting our family's life at risk as well. So that whole sentiment of being terrified was real, it was palpable, but we moved forward. Within my department, we moved forward as a unit, we moved forward as a department to do what was best for our patients. And we had to do what was best for our family. So to that end, how COVID affected myself personally is that because of my exposure, I moved out from where my immediate family is. So I have been self-quarantining at another place in Ridgefield and have been here by myself, except for going to and from work, for the past 8 weeks. Luckily, my family does live in Ridgefield, so we'll gather on a nice day in one of our driveways, staying 6 feet apart, and we do a lot of Google Hangout. We watch TV together via Google Hangout. We Zoom a lot with our other family members. But it's been very difficult. I have not touched another human being without having a pair of double gloves on in over 8 weeks. And it's very isolating, and it is very lonely. home and not put the rest of my family at risk for catching, this terrible, terrible disease. But despite how severe COVID is, how destructive it is, I think that as a community, as a department, I think that it has brought out a bright spot within people. And what I see is the generosity of people being brought out, with people donating masks, with small restaurants in New York City who have no business coming in, yet they're going to their place of business and they're making meals and they are distributing meals to people who are in need or to healthcare workers. That generosity and that spirit of community and that spirit of human compassion, I find beyond heartwarming. The kindness and the thankfulness from people as well that I don't know. Within my neighborhood, I was left brownies in my mailbox from people that I don't know. I know they live around me, but I don't know them, with such a lovely thank you note. They found out what I do and they expressed their thanks and their wishes for me to stay safe and to stay well. And that's just one example. I've had people stop when they see me. I walk on Main Street now for some exercise, and people have stopped and thanked me, because they recognize me. I used to work at Danbury Hospital for 23 years before I went over to Weill-Cornell. So despite the gloom and doom of COVID, I do think that our scientific community will find a vaccine in an appropriate time. I do think we've learned a lot from it. I think that the medical team unit has become stronger and more compassionate with each other. At my workplace, we are all put into teams and we are all watching out for each other constantly. There's 5 of us within my team. We make sure that we are all protected, that we are all safe. And I think that that has extended to the community, that the community is trying to stay safe, being kind, being generous, being concerned. So as bad as it is, I think at the end, there have been lemonades that have been made out of the lemons that we are dealing right now with. And I want people to remain hopeful, to remain cautious, and basically to just remain kind to each other.